Welcome back to part 16 of Training Muscle Lengths, the moment you've all been waiting for, the abs. If you haven't seen the other videos of this series, they are in a playlist on my profile titled Muscle Lengths. Before we talk about specific ab muscles, just want to point out the Linea Elbow, which runs from the xiphoid process of the sternum up top all the way down to the pubis and essentially divides the abdominals into left and right. When someone's really lean and you can see ab separation between the two sides, that is the Linea Elbow. And before you ask, the serratus anterior was covered in our chest video, so take a peek at that. First things first, we have the transverse abdominis, which runs in the backside from portions of the ribs as well as the top of the iliac crest and inserts into the linea elbow here. It is a very deep muscle. It's underneath our internal and external obliques. And while it does play a role in spinal rotation, its more important function has to do with intra-abdominal pressure. Basically, it pushes in on your abdominal cavity. So if you're trying to brace for a big lift, doing a Valsalva maneuver, that's going to be playing a role. Like we said, it's covered up by the internal and external oblique, which have similar functions. The internal oblique has a few different origin points. Most of them basically end up somewhere around the iliac crest and insert into the pubic crest, linea elba, and portions of the rib up top. The external oblique originates from portions of the thoracic ribs and inserts into the linea elba and down into the iliac crest. The external oblique is effectively on top of the internal oblique. So if we have our three layers of the abdominal wall, we have external, internal, and then the transverse abdominis. Both the internal and external oblique also function to increase intra-abdominal pressure, just like the transverse abdominis. When one side contracts, they cause rotation as well as lateral flexion. And when both sides contract or bilateral contraction, it results in flexion. So if you take something like an oblique crunch or whatever you want to call this, where we're some combination of flexed, laterally flexed, and rotated, our internal and external oblique are going to be shortened. And then as we extend, laterally flex, and rotate the other way, we end up in a lengthened position. I wouldn't suggest doing this exact movement, it's just the first picture I found representing the position. Moving on to the rectus abdominis, it runs from the pubic crest and pubic symphysis all the way up to the xiphoid process and the 5th through 7th ribs, and it's no surprise that it runs right along the linea elba. If your body fat is low enough, the rectus abdominis is very visible. It's what people call the six-pack. Along with the other muscles we already mentioned, the rectus abdominis also contributes to increasing intra-abdominal pressure, aka bracing. And the rectus abdominis, when it contracts and gets shorter, causes trunk flexion. Boom. Because our only movement function is flexion, it'll be shortened in flexion and lengthened in extension. And if you haven't seen our last video, we're just talking about thoracic and lumbar spine, obviously not cervical. Something like an ab mat is perfect for this, putting us in extension for a lengthened rectus abdominis, and then crunching up into flexion puts us into a shortened position. But what about lower and upper ab exercises? Unfortunately, there's not much evidence that that's actually real, and any difference you feel is due to oblique activation.